Hey folks, welcome back to the show. Great to have you here today. This episode is going to be a bit different than the usual. It's a topic that is very controversial. Well, it's not controversial these days. It kind of depends who you talk to. But basically, we're going to be talking to, frankly, a master, an expert in the field of facial rejuvenation today. I'm really excited to have this conversation because if you have seen this man's work, you too will be gobsmacked. I am. I mean, every time I go to Instagram and check out his account, I am gobsmacked at the quality of his work and how seamless it is. But before we get into that, you know that the first thing I always want to do at the beginning of every episode is to thank you guys, encourage you to share the episode with your friends in your networks, anybody who you think would get value from it. And of course, to sign up for the newsletter at natnidham.com. And number three, if you're feeling inspired after the episode, please make sure to go on to whatever platform you are listening to the podcast on, whether it's Spotify or Apple, and leave us a review, because it's those reviews that really make a difference to how well we're able to reach more people out in the world. Now, let's talk about facial rejuvenation. Have you ever considered it just for aesthetic reasons? Or, are you someone who has been or would like to use Botox or filler for anti-aging purposes, and you're kind of confused about whether, how good is it? How bad is it? Like everything else, it's nuanced, right? So today's episode really gives you the ins and outs of facial aesthetics and how to approach them with longevity in mind, with a true, incredible expert in this field. I am really honored to welcome Dr. Cameron Chesnut, a facial plastic surgeon, about his approach to facial rejuvenation and aesthetics. He emphasizes the importance of artistry and individualized treatments in his practice, which is why no two people look alike. When he's done with them, they just look like themselves, only better. He also addresses the use of Botox and fillers, highlighting the narrow lane in which they should be applied. So he's not saying they're bad. It's just you got to use them right, and the potential risks of overuse. We talk about advancements in minimally invasive techniques that reduce trauma and improve outcomes, which is why it's not such a hit to your longevity when you do these things right. So Dr. Chesnut really strongly advises that individuals really seek reputable practitioners and really think about long-term goals when considering facial procedures. We discuss various aspects of cosmetic procedures, their impact on longevity and overall well-being. And he really emphasized the importance of exploring the spectrum of available procedures. There's so much out there now, you guys. So you really got to do your homework and understanding the baseline tissue quality for long-lasting results. So in plain English, what does that mean? It means if you got to take care of your skin to get better results. I'm not going to go through the laundry list of everything that he talks about. He leaves no stone unturned, let's just say. And Dr. Chesnut is the facial plastic surgeon for the world's high performers, and he himself is a high performer. But people from all corners of the globe seek his next level results with astonishing outcomes from minimally invasive procedures that leave them looking natural, rejuvenated, and seemingly untouched. He is renowned for his progressive use of regenerative medicine and post-operative recovery techniques, as well as his dedicated personal preparation, how he prepares himself for performance readiness. Even his anesthesia protocol is next level. So I'm, again, not going to go into detail here. I want you guys to get it straight from the man himself. So if you want to know more after you've listened to the episode and you just can't stop yourself and you want to know more about Dr. Chesnut, you're going to go to www.clinic5c, like the number 5c.com. And if you want to see examples of his work, you're going to want to go on Instagram and go to @Chesnut. That's Chesnut without a T in the middle. So CHESNUT.MD. And now let's dive into the episode.
Hey folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider.
Dr. Cameron Chesnut, welcome to the show. It is a pleasure to have you here today.
Thank you very much for having me on. I'm excited.
Yeah, I'm stoked. Are you kidding? I've been like counting the days down. I'm like, yes. Especially since I mean, I we were introduced by you're a good friend, Ben Greenfield, and someone I've kind of gotten to know a little bit. And when he sent me you as a guest, I was like, I don't know. I mean, biohacking podcast, I don't know, longevity. And then I started to look into your work and look into you and what you kind of your whole persona. And I was like, oh no, actually that makes a huge amount of sense. So thank you for being here. I really appreciate you taking time to have this conversation with me.
Absolutely. Yeah, looking forward to it.
Yeah. So tell me, what led you to what you do today? You know, like
Yeah. Oh,
what's
wow.
like what made you did you grow up thinking I want to change people's lives by changing their faces, or what was your thing?
That's a great question. So, I mean, at a baseline, so I'm a facial plastic surgeon. Most of
Mhm.
my practice is cosmetic, and I just approach it in a very different way than most people in my field. And a lot of that is just very deep personal loves and connections of health and wellness and biohacking and, how do we can apply those to our lives, but also to my practice and patients. And so, at a very sort of granular level, that's where I currently am. But getting here, it's a really great question.
Mhm.
Goes back into, getting into medicine and not really knowing what you want to do. I was very open-minded about kind of what I'd end up in. I'm probably a cookie cutter orthopedist, actually, like a former collegiate athlete, and
Yeah,
kind of
yeah, that's yeah. I would think that's
yeah.
where you would have ended up for sure.
Right, but my brain as a child growing up was very right brain, if you will, or very like artistic and 3D spatial, and so I really gravitated towards those things as a kid. And then you honestly kind of turn that part of your brain off as you're getting into medical school because it's
Yeah.
so science and memorization and so I'm not going to say I forgot about it, but it definitely got neglected for a while as I was going through medical school. And then as I was exploring these specialties, I discovered, wow, there's a lot of really cool 3D spatial reconstructive specialties. Orthopedics actually is one of them, right? You're
Yeah.
kind of putting this back together, but that's very like algorithmic, less creative. And I sort of started discovering these more reconstructive or even cosmetic specialties that revolve around plastic surgery. And then with that, the face just really gravitates towards me from I love little intricacies and nuances, and which is kind of the opposite of orthopedics actually. And so that's how I ended up where I am. Really, is just following really how I'm wired a little bit, and then
Yeah.
mixing it with just what I love.
That's awesome. Well, and it's interesting that you say that because I've always said and I've always believed that when we look at medical doctors who do the work that you do, it's 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 a huge chunk of it is art. Like, I
Right.
mean, yeah, there's science, but there's such a big piece of it is art, and the art of what you do, and you in particular, actually, and I would say the people in your field who excel is that you don't get that cookie cutter look. You don't. Every person that comes through your practice walks out looking like a better version of themselves, and not like the last person that walked out a week ago.
I really
Which,
appreciate that. Thank you.
it,
Yeah,
it-
that's
yeah,
it's always the goal, and it's not the norm, like you say. Sometimes, and I understand as you're training, you learn in this very like algorithmic way. Like this is the way you do this procedure. And when you're first starting out, it's like this is what I have. I'm going to apply it to everybody, and you quickly learn that's not correct. And those surgeons that have the innovative capacity and the creativity, those are going to be the ones who take that baseline knowledge and learn how to apply it to each person individually, kind of what the nuances are. And when I hear facelift or a brow lift or an eyelid surgery, to me that is hundreds of different directions that we could go nuance wise versus like, oh, this is how you do a facelift. There is no answer to that. It's different for
mm,
everybody. Again, you have to sort of be in that and be wired and have the repetitions and have the understanding and have that spirit really to do it.
yeah. No, I think spirit's a big piece of it. I mean, there's a huge intangible to what you do. Like, how did you? Like, I'm fascinated, right? Because you would have been taught in med school, you would have been taught, like you said, all these techniques. This is how you lift, do an eyebrow lift. This is how you do a facelift or whatever the case may be. And for you to then sit there and go, yeah, but that's actually not what I want it to look like is
Right.
quite
There's a better way.
pretty
Yeah.
ballsy. I mean,
Yeah.
if you think about it, like and was it like an evolution, or did you just break away for a while and just said, no, this, I'm not doing that. I'm going to find another way. Or did you apprentice with someone? Like, how did you?
Yeah, the medical training route is very, it affords you a lot of opportunities if you take advantage of them to get that, you know. So my training and fellowship, let's say that's the last step of training you do. It's after medical school, after residency, you're already board certified. You're doing this additional apprenticeship type of training, was with a lot of different people. Instead of one or two surgeons, it was with, 28 surgeons or something. And so
Wow.
if you go in with the spirit of like, well, this is how you do a facelift, but you're also like, there's probably some better ways to do it. And you have that, not ballsy as much as just like, that's the way you think. Like,
Hmm.
this is how you do it, but why? And if you can
Yeah.
break down a little bit more, and then you have perspective from 28 different people, and you realize, well, all 28 of these do it a little bit different, then it
Right.
just kind of just opens up your mind a little bit to getting into how to think and what the real problems to solve are. And so I teach two fellows every single year who are at the very last stage of their training. They're, decades in, and I'm really just trying to teach them how to think.
Yeah.
Procedurally they can go do all the stuff, but like, what do we come across that are little problems that we can solve or solve better? And so if you have that spirit, and I have a very iterative process that I do with every case. After every surgery that I do, I detailed journal what I did and what I wanted to pay attention to and what I think I did different and what the problems I came across were that were different from one patient to the next. Then very interestingly, I don't get feedback on that for months until the
Yeah.
person's done healing, right? So my process is then I go through later and I review their photos and their videos, and I go back. So a lot of my patients that are coming in like, why are you taking videos? Well, because I want to see the before and after, and I can go look at all these nuances and get that feedback. I always kind of say I'm an athlete, and so it's like watching film after a game. You go
Yeah.
watch your performance and like, what did I do well? What could I have done better? I do that, but it just takes me months to get to get my film back later on.
Yeah, no, that's amazing. Well, and I think the word that keeps coming up for me, aside from creativity, is curiosity, right?
Right.
So you remain curious. You were always curious, and you reconnected with that artistic piece of yourself, which is where the secret sauce and the magic is for you. So aside from the aesthetics, which is amazing, you yourself personally have also a very different approach to even the practice of medicine as it pertains to you. And we talked about this, and you actually sent me a really interesting email last night where we and it's so true that in the medical profession chews up its people and spits them out. Like it's like medical doctors, unfortunately, maybe because of their training, maybe because of the pressures, whatever, they are some of the most broken people around, not because they want to be, but because they can't, like they're just carrying such a load. And you approach your craft but in this particular way, but you also, the way you train as an athlete bleeds into that. And maybe, I don't know, like, how did that kind of happen? Because it could have easily been beaten out of you in med school. Like, you don't have time for that stuff. Yeah, sports is great, good for you. Now you're doing this is your job.
Yeah. Yeah. I mean, I think I've always been very fortunately wired that way, if you will. Again, it's sort of my nature of who I am to enjoy competing in sports. And that was an outlet for me to have that competitive, nature go somewhere. So it never went away, even in medical school when you're kind of in a box, really, like learning all this massive amount of information. That was always an outlet for me, psychologically, cognitively, physically, to go train and do things. But with that comes, well, as an athlete, you learn how to rehabilitate, like how to train, and then you learn how to
Mhm.
compete, and then you learn how to recover, right? And if I really think about it now, those are the aspects that I apply to not just myself, but my patients and their procedures and process as well. As I'm prehabilitating them, I'm getting them ready, and then when they're here, I want them like as prepared as they can be, and then especially for them, the recovery, because you're recovering from an injury in this case, not even just like a workout, but I want that to be as optimized as it can be. And then as I apply it to myself, it's very much that process. Like I love what I do.
Mhm.
And everything that I do from a physical workout standpoint really revolves around making myself better or more prepared, whether it's just the physical longevity of my practice or how I work through complex decision making. Like I love jujitsu, which is a terrible place to learn how to make decisions. You're uncomfortable, you're being pressed or choked or whatever, and you have to kind
Mhm.
of learn how to make decisions under pressure. Well, that's not unlike the operating room. And so doing that makes me better at surgery. It makes me better at making decisions. It opens up my world to get better. And honestly, when you approach the top of something, it's hard to take those next steps. So some of those athletic windows give me abilities that I would have trouble finding elsewhere. And with the medical profession, you sort of mentioned it does chew up people and spit people out. And surgeons being a prime example, burnout rates are really high. These are high performing, high capacity individuals who go into this training regimen and get beat down quite literally. And so
Yeah.
if you don't have a bit of resiliency or grit, it's, you're just trying to survive, let alone thrive at the end, which is what we want to do. And then when you do get out into the real world, you're a bit broken. Metabolically you're broken, you're psychologically broken, all those things. And you've got to get back to who you were before. It's difficult to do that when you're busy and you have a family now and all the other things that may go into it a little bit. So I, again, just feel very fortunate that I had that spirit and that sort of like background to fall back on from a sports standpoint. And you can certainly get that in other places, that
Sure.
thought, paradigm and framework. But for me, that's where it came from for sure.
Yeah. Well, definitely say it. I would invite you guys just check out his Instagram because you'll get to see some of the workouts this person does. It's pretty impressive. I
Yeah.
really
And
like the kettlebell workout out in the snow. I thought that was really quite cool.
talk
Like,
about a
aren't your
mental.
hands cold?
Yeah, and you're jumping in
And
a
your
freezing
feet?
river, and yeah,
Yeah.
it's
Yeah.
all part of it though. It's that you're looking for ways to challenge yourself outside of the norm a little bit.
Yeah.
Definitely. Yep, being
100%.
uncomfortable. Yep.
Yeah, all about being uncomfortable. Okay, so I'm sure the listeners now are like, okay, now this is all really interesting, but give us some meat here. Give us stuff that we can do. So I want to talk to you about, you're a guy that looks at faces and skin and understands how we can improve them. And so I have a bunch of different topics for us. And the
Okay.
first one is, I'm going to start with people who, let's say, facial rejuvenation may not be in their wheelhouse, or it may not fit with what they envision they want to do for themselves, which is fine. So there's a growing number of things that interventions that people can tap into to supposedly rejuvenate their face, right? So we're in the world of fillers and Botox and lasers and microdermabrasion, which I'm sure is nothing, like next to nothing for you guys, but IPL, like all of these things. And so the question I always wonder, and we have two branches here as well. We have where's the world going with this evolving aesthetic that's
Hmm.
kind of being foisted upon us? And the other one is what is actually beneficial and what is maybe doing us more harm in the long run, which, number one is important just because we don't want to look worse down the road than we would have otherwise. And number two, let's say somebody today doesn't think they're going to do facial rejuvenation, but maybe in 10 years they do. I would imagine there's things you can do that would set you up better and things
Yeah.
you would do that really make it a lot harder.
Absolutely. Yeah. And this is a complex question. There's a lot of facets to this, and I'm happy to kind of chat through them. My practice is primarily surgical where I'm at,
Yeah.
and that ranges in age from 30s and up, right? Sometimes there's genetic predispositions, but it's very rare that I don't see somebody who's done something prior. So this is my world. I have a few, but for the most part, everybody's done something leading into it. And so I'm very, in tune, and my patients are traveling from all over the world. So I see all kinds of different things in different cultures even, and kind of what the norm is. But everything has its place. I never want to demonize or villainize any particular products or procedures because that definitely can easily happen. But in my experience, it happens when things get outside of their lane. Everything can have a little lane that it has a benefit inside of. The problem is some of these things, you mentioned filler, for example, something, if you go through my Instagram page, it almost is like I'm villainizing filler, but it's not villainizing filler. It is as much as just it's getting applied to every part of aging when it really has a very narrow lane that it does well in, right? But it's so easily accessible. It's on every single corner. Everybody does it. You don't know who's who. It's hard to sort through who's skilled and reputable and who's not, really. And so it changes the reputation of the product, and help in my world I see a lot of disasters from that because it's been applied outside of its window. So when we think about even like facial creams or lasers, those are skin treatments, right? And if you're putting a cream on your face and expecting it to get rid of all your wrinkles, you're going to be dissatisfied with that. It's not going to do that, right? If you're getting a laser and expecting it to give you a lifting, tightening procedure, you're going to be dissatisfied, even though the laser probably did a really good job in its lane that it was in. Laser being something like IPL, which isn't truly a laser, we could put it in that category. It's using light-based energy to cause a change in the skin, right? Those lasers have a very specific thing that they're good for. To get, not to get too sciencey, but lasers have a, we call a chromophore, a target in the skin, and that target
Yep.
is pigment or water or whatever it is. Well, that's all it's targeting. So to think that it's going to do anything outside of that little narrow lane is giving false expectations to it, right? And filler can volumize small areas of volume loss. Filler, just to be clear, I'm talking about mostly hyaluronic acid fillers. That's the most common by far. There are biostimulatory fillers and things like that that are less common, but they're all falling in the same realm of trying to add volume to areas that have lost volume from something external that you're injecting. So when you put filler for a little bit of volume loss, yeah, that can do a pretty good job. The problem is now we have like sagging and people think that filler is going to lift things up, which is
Yeah.
not true. Or even just the idea, you know, those of us that are surgeons know that those hyaluronic acid fillers last decades. They last a long, long time. They're a permanent implant or semi-permanent implant. But the thought paradigm amongst most injectors is that they last 6 to 18 months. That means that people are getting it over and over and over and over again, and then they're just adding this gel on top of gel. And eventually we see patients who it's migrated everywhere. Their face is less fat and more gel than it used to be, and it looks unnatural, right? Because the gel kind
Wow.
of goes everywhere, goes into fat pads, goes into muscle. Any hyaluronic acid gel in a muscle makes the muscle move funny, and we pick that up. You know, we have a whole part of our temporal lobe that just recognizes facial expressions, facial movements, and it something registers that that's off a little bit. And that's where you get sort of like that over application of this particular product or this realm of products that really gets outside of its where it should be applied, and it starts to make things look funny.
Hmm.
It may look, you may look different afterwards, but it's not necessarily better, right?
No. Yeah.
And it's this idea like that happens slowly over time. So people get this, I call perception drift. Their baseline changes to, well, this is what I look like now. What if you look back 3 years, you looked quite different, but it happens so slowly that you've just adjusted to it a little bit.
Yeah. Well,
So,
I'm even finding that I don't know that I'm finding, but I'm wondering if as a society, our sense of aesthetic is getting a little twisted, right?
yeah,
Where someone who hasn't had their lips filled all of a sudden looks like they have like unnaturally thin lips because everybody's supposed to have these plump kind of pillow lips, which is fine.
yeah,
Except that, I mean, I would imagine you've seen this more than me, but sometimes you see plump pillow lips that just start to look like they've been laying on for too long, like
right.
they don't
Yeah.
keep their shape. So when you say that filler has its place, like, are you saying, and I've always thought about this as well, like even with Botox and filler, that sense of aesthetic, that artistry of the individual applying it is a
Hmm.
huge piece of the puzzle.
Yeah. Yeah, and I think that that gets leaned on a lot by a lot of injectors, how artistic they are with it. And there's probably is some truth to that, but the real part of it is like knowing where the end of the applications are.
Hmm.
So I would always caution somebody who's doing filler with somebody who only does filler. That's the only tool in their toolbox, right?
Right, right.
Because when you're a hammer, everything looks like a nail. Of course, filler is the fix for it, but is it really the fix, or is that just all that person can offer? It's hard cognitively to separate yourself away from that when you're so good in your head, your identity, you're so good at filler.
This is what I do.
You're an artist, right? Well, of course
Yeah.
I can make it better. But again, it's different, but is it better afterwards? And so, when we think about aging, we have to think about all the, like, quite literal layers of the aging process. You have your skin that's easily accessible from the outside world. You've got your volumetric, and the skin is largely qualitative. What's the quality of that soft tissue structure, right? Then you have the fat pads that sit underneath the skin. And that gives a lot of the shape and contour. What's the volume status of those? So there's a quantitative and a qualitative aspect. How strong are our fat pads when we're young are a honeycomb structure.
Hmm.
There's fat cells within these, we call them septae, but they're like collagen bands, and it's solid, but that changes with time and with sex hormone changes and all kinds of insults to it. And so that structure changes. So you have qualitative and quantitative, and then you have like the ligaments that hold those things in place, and gravity takes effect, right? And that's the hardest one to address outside of a procedure, if you will. But it's also for a lot of people the most significant one, right?
Hmm.
They have some of these qualitative changes, but it's really the gravity that they're noticing. So they try to address all the other things, but they're not actually getting after that little nuance that is the key, the linchpin to their aging process that they want to be addressing. So when I get into these, like what works and what doesn't, I don't mean to say like nothing works. There's certainly improvements in your skin. There's certainly improvements in your fat pads, whether it's filler or some alternative like fat transfer, which has a high stem cell and regenerative capacity to it. So you get the qualitative and the quantitative part of it. But for a lot of people, at some point when they're noticing they're aging to a significant degree, there is a significant gravitational component that not much can address outside of a procedure. The
Right.
good news is the procedural paradigm for what's available is is so much greater than it used to be. And I want to say because of like the little innovations that we're making, and that's quite true. Facelift, what most people think of that is this like incision with all around the ears and back up on the scalp and this big massive procedure. Well, for some people, I can do that through these two teeny incisions hidden back in their scalp. I can get a lot of lifting done through those small accesses. It's like the difference between a open appendectomy with an incision up and down your abdomen and a little laparoscopic procedure when we can do those types of things. So there's lots of currently advancing things. In my world, it's pretty rare actually to think that way. It's more like, well, this is the facelift, this is what we do.
Hmm.
But like I said, those of us that are sort of like progressing these other alternative options can get really nice results with very minimal input. All that to say, it opens up these little avenues to address some of these other aspects that are probably more key than the stuff you can just get taken care of on the corner,
Yeah.
by.
Well, and I'm wondering, so to that end, I mean, it sounds like it is, but you tell me. So, because I would think that the trauma, the systemic trauma of a full facelift, like old school facelift, is pretty significant. And I actually had a conversation about this with a friend of mine who you just met, Amitai Ashel, who said to me, look, from a longevity perspective, getting a facelift is a really crappy idea because it's a massive trauma to your body. It's kind of like aging. But if we look at these newer, much less invasive techniques, then that's going to reduce the trauma
Absolutely, yeah,
dramatically.
huge. And an old school facelift definitely changes a lot of those qualitative aspects because we're delaminating or taking apart key tissue connections, right? I don't mean to do too,
No,
but
I know, but I mean, it's
we
like, how does the fascia deal, right? Like, how does it
right.
go back? Yeah.
So the trick is to find out where those areas have weakened and kind of leave the connections that are intact and important. For example, the skin's connection to the fat is quite solid. It doesn't really change much. It's the skin and fat's connection to the bone that sinks. So we leave the skin and the fat connected and we go down to the connection to the bone and we lift it up that teeny bit and refasten it. And we've avoided trauma to the key areas. Most of those deep connections we call are avascular, relatively bloodless. They're
Yeah.
not a highly vascular plane, and so we can make a lot of those little micro adjustments to the anatomy, again understanding the process of where the key areas are best and then strictly targeting them and leaving everything else alone, so we can avoid what Amate was talking about with that, basically advancing the aging process in the long term. We can actually make it, quite fortified.
Yeah. No, that's quite interesting. Okay. I have a question for you. It just popped into my head. I didn't even know I was going to bring this up. Face yoga.
Oh yeah.
Opinion.
um,
Well, because you mentioned ligaments, you mentioned muscles. And so I wonder, like, Is
Yeah.
there any, I mean, look, you're not going to turn your face back 20 years with face yoga,
Right.
but
Yeah.
is there
So
any value to it?
so there's been some studies showing some benefit to it. The projected, reasons that might be are blood flow changes, muscular strengthening, things like that. On the flip side of that, though, getting into like how Botox works, Botox like immobilizes muscles or makes them weaker so they can't put as much strain and stress on the skin.
Hmm.
If you're face yogaing all the time and you have weakened qualitative aspects of your skin, you're going to break it down faster with that as well. And then you get really into the weeds of like, well, what muscles are we face yogaing? Like the muscle in our neck, for example, that kind of pulls down, that kind of gives us these two bands as we age in the front. If you overwork that muscle, you will exacerbate the aging in your neck. So it's really, I know, that's, I wish there was a better answer
You
to
guys who
it,
can't
but
see, I'm banging my head against the mic, but I spared you the audio.
oh man, it's a hard one to answer for that reason. But again, there's studies showing benefit to it. There are others that show no benefit, and then there's some of these like mechanisms as to how it may actually advance aging in some of the areas. But you know what? Like I move my face all the time, and I exercise regularly, and my face moves when I do it. So
Yeah,
it's
right.
just part of the process, and
It's part of being
you know
human.
right, right. And we can get into the nuances of Botox if we want to there a little bit as to how it works, but again, it's the same thing. Like it has a narrow lane in which it has a benefit, and outside of that it can be problematic or lead to unrealistic expectations or, kind of even what the best practices are with it a little bit as to
Okay, so let's do that. Let's talk about the narrow lane and best practices because, if people are going to do it, then maybe, what are the things you need to look out for? What things should you keep in mind? And, where is it appropriate and maybe best to stay away from?
right. Yeah. And so with Botox, I'm using a brand name that is just botulinum toxin, comes from a bacteria. It's meant to immobilize muscles. There's multiple brands on the market, not just Botox. There's Dysport and Xeomin and Jeuveau and Daxxify. There's all kinds of, different brands for it. But the idea is when we apply it to the face, that you're putting it in the muscles of facial expression, which are, I'm just going to say, highly important for us to how we express and animate, right?
Hmm.
When you immobilize those muscles of facial expression, they don't put as much tension on the skin. So when we think about the lines around our eyes or on our forehead or our smile lines around our mouth, those are formed by repetitive muscle motions breaking down the structure of the skin. So if you make the muscle motions less intense, it doesn't break down the skin as much. So that's the mechanism by which it
I mean,
works.
then you can't move your face.
Right. Botox also has some like upregulation of some collagen genes and stuff like that. It's much more, it even has some neuro effects. It's got a lot of effects that we don't understand that well, but the main one is that muscular motion. So you can go freeze somebody's forehead and around their eyes and they don't make as many wrinkles, but you've also taken away some key functional components to them. A lot of people complain like my forehead feels heavy. Well, yes, because you were using the muscle in your forehead functionally to lift up your eyebrows, which you need to do because you have a heavy brow and you don't get light otherwise. And the second you take that muscle motion away, you feel it. Or someone looks like quote unquote frozen, right? Because
Yeah.
they're just like getting everything just completely immobilized. That's clearly the wrong way, the wrong path to anti-aging. So maybe a photo in repose looks totally normal because you don't have as many wrinkles, but the second you move, you look super unnatural, right? Which is an advancement, hopefully, that we go down the line as these before and after photos turn into before and after videos and things as well. But if you want to apply it well, you just need to find somebody who goes in it with that mindset, like let's just soften how strong this muscle is, so it still does its job, but at its end range of motion, it's not completely destroying your
Mm.
skin. And so I'm not anti-Botox for that reason. I'm just, for the most part, like you got to be really careful about who's doing it, how much they're using. It should just be like very minor, like soft alterations versus a complete like immobilization.
Yeah. Well, that makes total sense. I'm guessing it's a little bit like the filler as well. Like if you're going to go with a very light hand to touch things up, as opposed to
Right.
go in saying, I'm going to restore your 2-year-old cheeks.
Right.
And, like,
Right. And the thing about Botox is it does go away, right? It
it
has a
does. Right.
very
Yeah.
finite lifespan of in it, via the way that our body metabolizes it, it is gone. Filler being different. Filler has the same mentality for a lot of injectors that it's a temporary treatment, but it's not, right? It sticks around for decades, and that becomes a problem when they start getting like lumped together, like, oh, Botox and filler, these temporary treatments. Well, Botox is very temporary, filler is not. So separating those for most injectors becomes really, really, really important and misunderstood.
But there's ways to melt filler, right? But I guess you
Yeah,
have to
good.
find it first.
Good question. So yeah, there's an enzyme called hyaluronidase that
Okay.
breaks down hyaluronic acid. It's an enzyme that exists in our body because hyaluronic acid exists in our body as well. It's part of our skin structure. Um, we call it a glycosaminoglycan that absorbs water, provides
Yep.
hydration basically. And as we age, we very naturally lose the hyaluronic acid structure in our skin, like its hydration. And so there's just, oh, well, we just add it back with an injectable. Well, the problem is you're not adding it to the skin, you're adding it to the fat and the muscle underneath for the most part. But we do have this enzyme that our body uses to recycle it quite normally. And we can exogenously inject that enzyme to try to break down the filler. The problem is it's not perfect because it doesn't get all the filler to go away. Maybe it breaks down some portion of what's there, but it also affects our native hyaluronic acid, what exists in our skin, right?
Good question. Yeah.
And this gets into a huge debate in the field because a lot of injectors will vehemently defend that it does not affect our native hyaluronic acid, does not lead to any long-term issues. And I think what the confusion is, it does affect our native hyaluronic acid, but we're able to regenerate a lot of that, especially if
Okay.
we're young. Especially if we're
Okay.
young, because we're constantly making it anyway. And if the dose is low and they're highly spaced out. I see issues when people get a high dose very frequently, like every few days, they're getting this really high dose. It overwhelms their ability to regenerate their native hyaluronic acid, and they can actually have qualitative soft tissue changes in the areas that's injected. Now, this is, like I said, a really hot topic in our field. People are very opposed to that viewpoint, but I see it and I can't deny that it happens. Most of the time, super safe to dissolve, very responsible, infrequent, low dose, no problem. It's the like aberrant outliers that there can be issues with. So yeah, if you can, like I use it when I dissolve it, I use an ultrasound. So I
So you're
directly
looking for
locate
it.
right where the filler is. I put the smallest amount possible right in the right place. I'm not like blanket flooding an area. It's just like, oh, there's the filler, right to it. Or even better, I'm often removing it surgically because then there's no enzyme involved at all. I just see the filler and take it away.
Yeah. Wow.
Yeah,
Okay. Well, that's so. So would you? So maybe for, and I'm trying to think. I'm trying to think of the audience, and so we're going to have different people in the audience, and we're going to have
sure.
people who are like, "Sign me up. I'm in. I'm in. Whatever he's selling, I'm in. I don't want to look bad. I don't want to look old." And then we've
Right.
got other people who are younger and saying, "Okay, well, maybe how do I need to think about this to
Right.
prepare myself and to leave myself in a position that whether it's when I'm 40 or 50, maybe even 60, that I'm in the best possible position to have the least amount done for the best outcome."
Right. Yeah, that's great. And like I said, I would love it if everybody came to me au natural, nothing done, but that's almost never the
Well, not
case,
these
right?
days. Maybe 30
Right.
years ago, but not now. Yeah.
Right. And part of it, or if they do, they're quite a bit younger and they're just getting in the pipeline a little bit early as to what can I do. So, like I said, it's just really, and it's hard because the person you're usually looking at to guide you is that person on the corner in your local aesthetic place, and they got one trick and they're going to keep applying that to you, maybe not telling you like you're probably ready for the next level above what
Right.
they can actually provide you. So it's I mean, full-blown honesty, it's a challenge to really kind of sort out the pearls from the poo a little bit and what we're doing. And but it's just kind of understanding the small aspects of, okay, a little bit of Botox or a little bit of this laser or whatever. Those are appropriate in bounds. You don't want to overdo it. You don't want to overpromise. If it sounds too good to be true, especially in a non-surgical setting, it probably is, right? Tightening is like a big one. If you find a device that you think is going to tighten your skin, you are damaging your skin, your microvasculature, probably compromising your future procedure that you will maybe ultimately need down the road. Those are things to be careful with for sure. And then I think also just kind of like getting in that pipeline early because a lot of these procedures are so much smaller now.
Hmm.
It's not uncommon to see somebody in their late 30s, early 40s, mid 40s who are like, pursuing a more robust and durable and corrective type of procedure with very minimal penalty or input to get that done, right? So it's kind of like when you're ready to explore, start exploring. Look at
Yeah.
what's available to you, and maybe you'll decide, I don't want to do something like that. These are better options for me, but at least look at the spectrum of what's available and try to understand what's there, because getting procedures younger means less surgery to get to a good result. You can always get to a better place. I can get somebody to a better place at 50 than I can at 70 any day, right? That same person. And then it lasts longer. And that's the other one of these, is like where your baseline tissue quality, strength, and structure is. That's going to, when you get to your end result from your surgery, how long it stays there is very intrinsic, inherent to you. Like what's your collagen and elastin status? Are you, again, one of the things we talked about before, you can teach me about, are you taking peptides that are supporting those
Mhm.
types of things?
Mhm.
What's your sex hormone status? Like all kinds of things that, can determine how long it lasts.
So that was so that was something I was going to ask you, like how long people can expect it to last. So I would imagine that being on for postmenopausal women, being using like replenishing their hormones
Yeah.
is going to be a
Yeah.
big piece of the puzzle, just in terms of quality of skin and ability to heal, like the whole nine yards.
Yep. And, this is a whole podcast topic. You could have someone
Yeah.
on to talk about just this who's like wildly passionate about it. In my practice, I have a whole functional medicine arm of my practice that is basically just extended as an out pocket or of my recovery that I do, which we haven't really talked about much yet. But
We're getting
I
there.
have all the modalities and all the tools to help this like recovery in a functional medicine setting, regenerative medicine setting. So because of that, this, outlet of a full functional medicine practice has developed, which I have a whole other provider who knows way more than I do about these types of things. And so I kind of punt to her when we're getting into these, because I would love, I shouldn't even say this, because I'm a little bit neutral about whether people are going to be on hormone replacement, totally dependent on them, right? It's an individual conversation. Lots of factors go into that conversation. From my longevity of my procedure, sure, I would love it for everybody, but it's not right for everybody. So
Hmm. Hmm.
I let that sort of get sorted out. And if that's in the cards for somebody who is postmenopausal or perimenopausal more commonly, then great. I know that I'm going to get a little bit more duration out of the procedure afterwards, because they have those sex hormones flowing around. Our fat pads, our skin too, but our fat pads and those ligaments are wildly receptive to estrogen and progesterone.
Okay. Yeah.
Adipocytes, fat cells, like it fuels them, and so they change when those levels change, and that means our face ages differently, the outcomes of the procedures change. So we want to, get around. And if somebody's not on hormone replacement, I take that into account and I've customized their plan that way. I'm going to use more stem cell dense fat for that person so that I can sort of like get around some of the issues with their native fat cells and really, go on the regenerative medicine route with their own fat-based stem cells and putting it in their facial fat. So I'm helping to not only volumize it, but, regenerate and rejuvenate it with their own stem cells.
Cool. Okay. Well, that's interesting. Okay. So hormone replacement, if it's there, is great. If it's not there, you still have workarounds, but it is going to affect to some degree how long the procedure is going to last.
Absolutely.
And so, can I ask, like, it's got to depend. Like, I mean, like, I want to ask these
Totally.
questions, and I can imagine you're going to sit there going, "Well, it depends how long it's going to last. It
No, it's
depends
a
on
super good
genetics."
question. And
And yeah.
yeah, super good question. There is genetics to it. There's baseline tissue quality things to it. But the big one, the hardest one to quantify is, when are you ready for another procedure, right? Because you
Mm,
get this one when you're 42 and it looks great. Well, when does it, as you start to age, you would have been on this curve anyway, and now we got you to a better place and the curve starts dropping. Maybe even it hasn't met up with where you would have been. If you get a procedure at 42, you will always look better than what your baseline would have been as time ticks forward, right? Because
okay.
you got a new starting point. Um, but as things age normally, when do we cross that arbitrary threshold with when you're ready for a new one? If you're a person who never looks in the mirror really, and you're kind of like happy with your baseline, it's going to take you a long time. But if you're like in your magnifying mirror every day, digging into where it's going to happen faster.
Yeah.
So, and that's just the reality of it. It has much more to do with that, the psychology of it, than it does with the like physiology and anatomy of that longevity.
And do you ever see like an issue with someone whose face looks decades younger than the rest of them?
Oh, yeah,
And
good
now
question.
I'm talking about your older patients, right? I'm
Right.
talking about your patients in their 70s, maybe in their 80s, maybe they've seen you like you've done what is it revisions to the work,
Yep.
previous work you've done. Um, and I mean, I kind of said this jokingly the other day. I said, okay, great. So my face is going to look amazing, but my butt's going to be hanging down. Like, I mean,
Right.
but I think which speaks to also in large part how we take care of our bodies, which I'd love to talk to you about because how we take care of our bodies, our fitness level, all of that is going managing your inflammation is going to have a massive impact on everything, on your face and everything else. But do you see
Right.
that kind of disconnect
Oh,
start
yeah.
to happen at some point?
Yeah, and this gets into a little bit of like rejuvenative versus transformative surgeries, like how to, if somebody's 70, my goal is to make them look like a really phenomenal 70-year-old, not necessarily, and people are gonna be like, well, I want to look 55.
Oh, but that's
Well, I
perfect.
get that.
Yeah,
I
yeah,
get
yeah.
that. But we really want you to look like yourself and normal at 70, which can be incredible. You can be really, really good. But that involves oftentimes, especially let's say we're using the age of 70 for real, like it's going to involve sort of a head to chest kind of like full rejuvenation to make that natural look happen to it. So I kind of tell people, like, even as I'm looking at you, everything that I can see on you, I would be treating, including the back of your hands, as I can
Yeah.
see the back of your hands right now. Because that's often one of the mismatches. So when I'm doing fat transfer or laser, which I'm using with almost every surgery that I'm doing, these are non-surgical now, right? No cutting, no sewing, but really important adjuncts non-surgically to my other procedures. I'm applying those literally everywhere from your chest to your hands to make things match better with what we're doing, maybe surgically in other places.
That's so interesting. I've always wondered that actually. That's really interesting. Okay. So let's say somebody's decided, all right, I'm doing this. I'm going in. What's your do you give them a protocol for before they come in?
Yep.
And what does that look like? And there was another thread I wanted to kind of tease out, but I've now let this cat out of the bag. So let's go with
Sure.
this.
Let's roll down that. Yeah. So I tailor this to my when we consult for the first time, I do like a little pre-screening process to get to understand people better, and I give them an idea of what we might talk about. I do not say yes to everybody that I talk to. I just can't. And like I said, I love what I do. I'm very passionate about it, and I feel like every time I do it, this is like my Super Bowl, right?
Yeah.
I'm giving a big part of myself away. I'm really focused on this. So I'm definitely more of like a quality versus a quantity type of surgeon. We can talk about that later, how I get up for procedures and how I'm at my optimum level. I can't do that 3 times a day, every day. And
Mhm.
so I
It would
am
be
very,
exhausting.
right, right. And so I'm just very choosy with who I pick. And so if we have chosen each other, that's probably the best way to say it. If we feel like we're a good fit, like I think it's going to be a slam dunk. We're going to nail this thing, right? So there's that whole part of it. And as we get into that, my big job is to understand where are you at and what are your goals. I need to like deeply seek to understand that so that we can put this plan together. And as we're doing that, I often get a sense of like, well, where are you at in your, like, if you are a wellness focused biohacker, my most common thing I hear is like, I want to look like I feel because my patients feel great. That's the best case scenario for me, honestly. If somebody says that to
Mhm.
me, because I'm like, you are a happy person who's going to be resilient and recover well. That's the dream, right? I
Yeah.
can make you look like you feel, no problem. And so that is often where we're going down. Those patients tend to be very like keen on their preoperative. They have that sort of a little bit of an athlete's mindset, like, well, how do I get ready for this?
Yeah.
It's the best question you can ask. Like, all right, let's do this. And
Yeah.
and so oftentimes it's just like, all the normal, like optimizing your physiology and metabolic profile. I love that's good going into surgery, sort of in the best, it's an event. You have to recover from it. Like, I say when my wife, we have 3 kids, and every time she was going into a pregnancy, she was like training, like she had a big event
Amazing.
coming up.
Yeah.
Same thing here. You're going to have some recovery time afterwards. So I want you to be in your sort of peak physical and mental condition. If you train for something, even just the act of training for it makes it easier to go through, right?
100%.
And then we have all of the sort of like peptide, metabolic and supplement based things that we can go leading into it. And I really tailor that into how interested somebody is in that because, you and I talked a little bit about peptides. If somebody is like, doesn't even really know what that is, Now, your listeners are definitely going to know what that is, but if I'm talking to, in my world, that is way outside the box. Nobody, I might be the only one who's utilizing those for recovery in this way and pre-juvenation and things like that. So when I start talking about like oral versus sublingual versus injectable peptides, that can really pique somebody to be like, injectable,
Yeah.
I'm not as into that. So I really feel that out and get everybody kind of customized to what I think is going to be best. And it varies on the procedure they're having too. Like, are they having free fat grafting or are they not? Like all of these kind of things play into it. And then oftentimes we'll get them, again, 100% of my patients are traveling. So that's the more challenging. You and I talked about this before in a little bit. That's the more challenging part for me before they get here because I don't have hands-on quite yet. We're doing all these things from afar, often internationally. And then
Hmm.
they come and then I have them here for the whole week. It's like fun week of recovery. Fun's the wrong word, but it is a fun week of recovery and
Well,
just
it
like
is. It's
a lot of contact, daily interaction. It's like really wonderful. And we can really dive into all these modalities of hyperbarics and pulsed electromagnetic frequencies and post-operative nutritional IVs that are even sometimes customized to what their genetics are. If we got to do some of these functional medicine things beforehand, how do you methylate?
yeah.
Like we can make
Yeah.
all these things sort of customized, but as we were getting into it, there's these like multiple facets of the pre, the during, because during the procedure, I'm using a lot of regenerative medicine, growth factors, stem cells inside of the actual procedure. And then afterwards, we have all these other, again, sort of modalities to go through. And if I can get I talked about mobilizing stem cells. If I can do that preoperatively with hyperbarics or supplements or whatever, it may be great. They're going to have like some momentum into their recovery that's even better.
Yeah. No, well, this audience, well, some of them know about stem regen. I'm about to release a second podcast with them, but it is exciting as things unfold and as with the peptides that you use pre-op. What are are you comfortable talking about
Sure.
which
Oh yeah.
ones you found to be the most helpful for you
Yep.
for your
Yep. So
patients?
most of the ones that I'm utilizing beforehand are just targeted around wound healing, right?
Yeah.
Mostly like a lot of skin based thing, collagen based. And so that's going to be BPC 157. It's going to be thymosin beta 4, and then GHK copper, kind of the
Yeah.
classic ones. And, GHK copper is nice because it's small and it can go through, you don't need to inject it, things like that. So those are, again, kind of varying from sublingual. Usually it's sublingual or oral leading into those because it's just more tolerable and easier to kind of, facilitate those things. But those are my main peptides pre-operatively, and oftentimes post-operative will continue them for, I love it if it's like 60 to 90 days post-operative, which just gets a little bit into how long the recovery periods from these things really, really are.
Yeah. Well, I mean, I think that in some cases it can shorten the recovery period, right? I mean, in a
Mhm.
best case scenario.
Right.
Um, yeah, I'm interested. Have you ever looked at something like ipamorelin, which is it's a growth hormone releasing peptide, and I wonder if that would sometimes be helpful. And
Yeah, and
I
I've
feel like
I've
it's bioavailable orally. I
I've
don't.
dabbled with that one a little bit personally, injectable form. I haven't used it for my post-operative patients on a regular basis, though. Yeah, that,
Yeah.
that would be interesting.
Yeah, that might be an interesting one too. Yeah, no, I mean, my mind is racing. I'm like, well, bioregulators could be really cool for that
Yeah,
too. We'll have to talk about that too. So,
absolutely.
but I would imagine that coming in, like all of the longevity, healthy aging practices, like reducing inflammation. You mentioned metabolic health earlier. Like, you don't want somebody coming in necessarily who's like super insulin resistant and has
Right.
super high blood glucose. Like, and so you get, I would imagine you get that other arm of your practice, hopefully working with them to kind of figure that out before coming in.
Absolutely, yeah. And everybody has a preoperative visit, sort of a primary care visit where we have laboratory work and vital signs, but it's a super treat when somebody gets to come in and do that with us because it's just a different level.
Yeah.
It's a different level of look. It's a different level of like laboratory work, and then just the eyes on it are a little bit more discerning. I don't always get that again with international travel. It can be a
Okay.
challenge, but even from afar, we're very well oiled to coordinate the travel and that whole experience. And so we have a really good mechanism to even with somebody's primary care doctor who may not know as much or be as much into that, we're still getting sort of the information that we want from afar. Yeah, so it can be a whole experience, which is really fun and exciting and honestly life changing for people because they have that information from that point moving forward forever afterwards. So not
Oh,
only
for
is their
sure.
recovery better, but their life's better afterwards. And you mentioned like the I word and inflammation that everybody wants to shut down and stop. In my world, it's a little bit different because some of that
Mhm.
inflammation is good. We
Yeah.
need it to heal. Like I could give everybody steroids and stop that, which is what a lot of my colleagues do. They just like stop all the swelling afterwards, and everybody heals, like looks like they heal faster, but you've shut down all of the actual mechanisms that give longevity to these procedures because there's no healing inflammation left either. It's this idea of
Interesting.
avoiding discomfort. We all want to make everybody comfortable right away, but then you also take away all their progress. You stifle that a little bit. So I love the peptides because they're helping, and hyperbarics and all these things because they're helping me like modulate the inflammation better. I want to build more elastin tissue, which takes inflammation to do, right? I want to get rid of all the inflammation that may be, changing some of those other tissue quality aspects, but I want great, elastin afterward. And I keep
Yeah.
saying elastin because everybody talks about collagen, collagen,
I
collagen.
know, but elastin's the bomb. Like
That's the
elastin's
one.
where you
Yeah.
want it. I
And I go
know.
to great lengths with my regenerative modalities and with my peptides and with all these things. I'm trying to, elastin is the fragile one of the two, right? It's a delicate flower compared to collagen. Metabolically, structurally, oxidatively, it's harder. And so we want to like really focus on that elastin because that's a lot of those long-term results right there.
Yeah. No, that's amazing. I mean, it is I love that you mentioned that about the steroids because you wrote that in the email yesterday. I wanted to ask you about that because I think that's so it's such an interesting point, right? That we try to keep people as comfortable as possible, which of course there's value in that because pain can be really taxing on people. And
Yeah.
yet, you know, preparing your patients to embrace and accept a certain degree of discomfort. And I think the problem with pain and discomfort with a lot of people is fear, right?
Right.
It elicits an immediate fear response right out of their primal brain. It
Hmm.
hurts, therefore it must be trying to kill me. And
Right.
if we understand it better and we can work through that fear and kind of accept it, it's just part of a process
Right.
and probably helps you come out the other side even better.
Right. And that being said, I am very like I don't want my patients to be in pain afterwards, right?
No,
I
but
just
you don't
don't
use
want
painkillers either, right?
I don't. So yeah, that's a whole topic of I do opioid or narcotic free anesthesia and recoveries. And this is successful 95+% of the time where nobody needs a pain pill after their procedure with me. And part of it is the surgical technique and how things are executed. And, you were talking about as far as like executing the minimal amount to get what I need, but doing it very deftly and, sort of minimal trauma. But then there's also just like some things are going to hurt afterwards. And so
Sure.
instead of using, opioid for that, I'm using like a long acting nerve block with a local anesthetic that
Mm,
lasts 2, 3 days. And thankfully on the face, it's very amenable to those types of treatments. So the last thing I do in the procedure is, kind of use these very strategic nerve blocks to eliminate any discomfort. Most postoperative discomfort's in the first 24, 48 hours. So if I can get somebody through that with just a local blockade, they don't need any pain pills, they're comfortable, it just kind of takes the edge off of things. They have minimal trauma from whatever we did do. I'm using growth factors aggressively afterwards. I'm using stem cells that I took from them on their face if I lasered. All these things to try to minimize some of those discomforts. And then we get them through the first 24, 48 hours and they're good. They don't need anything after that. Even during the anesthesia, I don't use any narcotics or opioids because of the cognitive effects that they have and the effects they have on our gut and things like that. So it's a challenge and it is way outside the norm to not use those types of things during anesthesia. But we're talking about cosmetic procedures here. I do not want to neurocognitively compromise anybody ever for an elective thing. I want this
yeah.
to be like so neuroprotective. And so it takes a lot of extra effort and skill to do that with my anesthesia team too. But we're all very much on the same page as far as like, this is our ultimate objective is do no harm, including with the anesthesia, but it makes the recovery better. If your bowels and your brain work better post-operatively, it's a happier experience.
Everybody's happy.
Right,
Yeah.
right.
So have you heard, I mean, this all sounds fantastic. And I think what's great about this conversation for people is that it opens a different conversation for them to have with whoever's doing their procedure. I
Right.
mean, I think that understanding that there might be a different way of looking at things than what we traditionally believe
Hmm.
is the first step towards asking better questions and maybe looking for getting a better outcome, which is,
Sure.
and I don't, and we were talking about this earlier, and I do think that in the space that we're in of longevity and biohacking, where we're improving people's lives, the length of time they're going to live, and hopefully improving their quality of life as they do so, having little tweaks to your face might not be like, it may become more normal or more desirable as like if you're 80 or 90 years old and you're feeling like you're 50 or you're 60. And I just think that understanding that what we're after in this biohacking space, and then having our physical selves reflect that a little bit more accurately, maybe it might become more important to more people.
Sure.
And I do think that your approach, where you're talking about taking someone who's 70 or 80 and helping them to look like the best version of their 70-year-old face. Like, I don't know why, but Helen Mirren, the actor,
Yep.
just popped into my head, right? And
Hmm.
I saw her somewhere recently and she looks phenomenal, but she looks like she's her age. And
Right.
I sat there and I remember the last time I saw her on screen thinking, I wonder if she's had work done that doesn't look like work. You're laughing.
The
But
best case scenario, right?
right? But I mean, because she looks like her, she looks like she's lived a life, like she's lived this life. All of her character, everything is still in her face, and yet she looks flippin' amazing, but age appropriate. And that's,
Right.
I don't know. I know that's my utopia. So yeah, there you have it, guys. I am shallow a little bit. That's where
That
I go with these
Well, that is
things.
my jam, and I would argue that that is not shallow. And I think that this question is going to be answered more and more, honestly, as the decades go on, and these things start to show as longevity does increase. It's like the health span, lifespan idea. To me, your appearance is part of your health span, whether we like it or not.
It totally is.
And I
Yeah.
think it's a little bit of a chicken or the egg with, so you feel better, but you don't look great. That's going to be an anchor to some degree. So you need to keep that up a little bit. And it's maybe not a perfect analogy, but other parts of our tissue wear out as well. Joints being a prime example, and you get a joint replacement, or on up to a lesser degree, you go clean up cartilage via an arthroscopic surgery so that it's not being an anchor for you as your lifespan moves on. Who's to say that sort of your facial appearance isn't part of that a little bit too? And if you can do something that's analogous to an arthroscopic surgery to just get a little improvement there, it's not saying it's going to fix your knee, but it's going to make it feel better and work a little bit
Mhm.
better. Same thing on
Yeah.
your face.
Well, and I recently had a conversation with someone about the concept that that skin aging in and of itself can be a driver of systemic inflammation, which people don't think of, right? People think
Right.
if your skin looks like it's aging, it's a sign of you aging from the inside. And this conversation kind of turned that upside down a little bit and said, actually, and I think it's a Baltimore longitudinal, some Baltimore longitudinal study. I don't know if you've read it or seen it. Probably you have, but
Yeah.
that was saying that skin aging actually drives systemic inflammation. And as I'm listening to you talk and talking about a lot of the procedures you're doing, where you're bringing stem cells in, and so you're bringing health back to the tissue. Is this something, do you think that can kind of maybe play a role?
I
Am I
really like this
stretching?
tie-in. I do like the tie-in.
And
And, I would say it's more psychological probably than the physical nature, because a lot of what you're saying about, skin aging, driving internal aging has to do with just the surface area of our skin, the largest organ, that
right.
kind of classic thing. Same with our gut, right? Our other,
Hmm.
like, barrier to the outside world, issues with our gut can lead to systemic inflammation. It's the exact same
100%.
thing on our
Yeah.
skin. So, when we're talking like 9% of your
Yeah,
surface
only a little
area
bit.
being
Yeah.
improved. I don't think I could a good conscience say it's going to probably have a huge driver of our systemic inflammation or change. But again, just think that it's so much more multifaceted and important than that, because on the flip side of that, when we have an entire region of our brain dedicated just to understanding the face, that's not normal we don't have that for our buttocks or our abdomen or anything like that. It's
No.
our face, right? So it carries a different weight socially, it carries a different weight psychologically with how we feel, it carries a different weight with our communication. So it's just more important. And I
Yeah.
think that's kind of the nuts of it right there.
Yeah, no, and I agree with you. I hope that more people come back to this middle ground, because um you do worry what kind of an impact it's having societally on kids and even young people, as frozen faces and distorted faces. I mean, and like, not to diss anybody at all, but
Right.
just like, changing appearance and freezing parts of people's faces, like what impact that's having on people's ability on when it comes to nonverbal communication. I mean, which
Right.
is so important. Like, you can come into a room and learn something about someone before they even open their mouth.
Yeah. Whether you know it or not, it's happening.
Yeah.
Right. Yeah.
Yeah. Yeah. Now, I had a coach one who called it human Wi-Fi.
Yeah.
Like,
I like that.
yeah.
I like that.
Yeah. All right. Well, I'm sure I could dig up more stuff, and I could talk to you for a really long time, but presumably maybe it's going to be time to wrap up soon. So, Karen, where can people learn more about you, what you do, and also who's your perfect patient? I mean, I think anybody who's listened to this carefully knows, right? It's
Right.
someone who's approaching this process as an active participant who,
Mm-hmm.
has a certain outcome in mind, who has a certain, but why don't you tell us in your world
Yeah,
instead of me saying it?
from a real standpoint, I can do a lot for a lot of people, I guess. But again, I'm very intimate with this and my relationships with my patients. So I generally like somebody who, yeah, an active participant who wants to be better, who's open-minded about the best ways to do it, who's realistic in their expectations, and then who's going to maintain it afterwards. Because for me, I'm putting everything into this outcome is everything to me, but then I hand it over to you essentially as well, in that relationship, like, take good care of it, please. So I want the
Yeah.
person who's going to do that. And again, mental health is a big part of this for me as well. Like, I want somebody who
Hmm.
comes in sort of ready to do it. And I think the best way to sort of learn that is, it takes a long time to get educated about it. And that's the entire purpose of my social media, is to, number one, educate people about these topics, because I'm so passionate about them, and a lot of them are underrepresented or under talked about. To understand what before and after photos look like, there's thousands of them on my page, and
Hmm.
you get a real good sense of like what my before and afters look like. If it can be posted, I post it. Basically, there's
Yeah.
no. It's just I want you to see realistic, right? And then I'm also really open about the recovery process, what it looks like. It's different for different people, different procedures. That's important to understand, because far too commonly in my world, I hear, oh, it's a 2-week recovery from your procedure for like a relatively big procedure, which is absolutely not true. There's no such thing as a 2-week recovery. And it just sets up unrealistic expectations and kind of like a recipe for disaster,
Hmm.
psychologically, a little bit in the recovery period. So I'm really like to educate about all those things. And you just get a sense of like who I am, what the process looks like, maybe what you might need a little bit. And then when somebody's ready to like maybe reach out, we have I do a screening process that's totally free, where I actually look at your photos and the more you write, the more I read, kind of thing. And
Yeah.
I really get into seeking to understand a little bit and giving you a really good idea. Like, now this is what we might talk about. And here's even some pricing that goes with it. And then
Hmm.
from that, you can say, okay, I like all this, let's talk more. And then that kind of gets into our first real face-to-face like this, and then we kind of run through everything and get to know each other. And that's a long visit usually. And that's kind of that's how things get rolling a little bit.
Yeah. Yeah, no, that's really interesting. And I would say also for your patients, and it's really important to look at your page, because the people that will align with you will be people who align with the kind of work that you do,
Right.
which is less, it's transformative, but not like it's not transformative as in looking like somebody different. It's more
Right.
transformative as in how you look today versus how you look tomorrow kind of thing. So,
Right. Yeah. And I, again, I like to just put everything up there because everybody's a little bit different in what their goals are.
sure.
Some people have like more, we're always balancing an input and an output, right? Some people, the output's so important, they'll do any input. And so those procedures may be a little bit more invasive versus somebody who's really has a wall of how invasive they're willing to be. And then we take all the result. And this is where this is where I excel, is taking all the result I can get out of that little input. And so you get to see the whole spectrum, right? It's different for every single person on there. And like I said, I'm really grateful to the people that let me show their photos, because not most of my best work will never be seen, right?
No.
That's the
Yeah.
tragedy of this type of artistry. But yeah, you definitely get a sense on there of what's available.
Okay. Well, Cameron, thank you so much. Definitely let people know where they can find you. And this has been a great conversation. I've learned a lot. Hopefully, everybody has as well. And hope to talk to you again soon.
Yeah, let's connect more on peptides. You could teach me a bunch. I love it.
I'm in. All right. So it's on Instagram.
Yep,
Cam-
chesnut.md, and there's no T in the middle of chestnut, CHESNUT
okay.
dot MD. Yep.
Thank you very much. All right. Thank
All
you so
right.
much, Cameron.